Welcome to the Dr. Lexi Show, where I take pregnancy topics and break them down into simple terms to help you advocate for yourself and your pregnancy. I'm Dr. Lexi, a board-certified OBGYN and maternal-fetal medicine specialist, which just means a high-risk pregnancy doctor. And today I'm joined by a very special guest, Nichole Smith. Hi, Nichole. How are you doing today?
Hi, I'm doing well. Thank you.
Good. I'm so glad you're here.
Yes, I'm so happy to be here today.
Thank you. Thank you. Can you tell our listeners and individuals who might be watching possibly, but can you tell our listeners what it is you do?
I am a portrait photographer. I specialize in luxury portraits for women specifically. Of course, I do specialize in children as well, but typically mostly 90% women.
Yeah.
Yes.
And for those who, if you're okay, we can put your website below and like a link to it so they can kind of see some info or something to your social, because
Sure.
I want people to, I'm getting chills right now, honestly, no lie. I want people to see the way that you see people, the way that you're able to like capture these pictures. She also, by the way, did the photos from my website, and I was flabbergasted at how she made me feel so beautiful inside and out.
Thank you.
It's fantastic. So I do feel like a lot of the photos you take are of women entrepreneurs, correct?
Correct.
Can you give us some like examples of women you've worked with, not necessarily their names or anything, but like people, what they've done and just some of their stories?
Well, it's interesting because once I decided to narrow my niche down specifically to women, it just so happened that I would say 99% of my clientele are female-owned businesses.
Wow.
So these are really empowered women. They know the value in self-care,
Mm-hmm.
and that runs the gamut with healthcare, beauty, you name it. And it's not that I was seeking it.
Yeah.
It just came to me that way.
Yeah. Just happened.
So I really try to build a community around
Mm-hmm.
what I'm doing. So not only is it portrait photography and about imagery, primarily for businesses or for their own personal use, it's about creating community.
Yeah.
Yeah.
Do you do any portrait photography for pregnant individuals? Is that an area you've kind of worked in?
Yes, absolutely.
Yeah.
And I love going through that process with the mom and the dad and the family, from when they're in the belly to when they're born and all through their childhood and familyhood.
Yeah.
Yeah.
So I guess I'm just curious. I've never been pregnant. I've never had a baby. I've obviously cared for a lot of individuals who are pregnant, and I did have a couple of, this is a random fun fact. Someone asked me, they said they were doing their photo shoot and they asked if they could do a milk bath, if it was safe. And I'm like, sure, you can sit in a vat of milk if you'd like. But I was like, that's a lot of milk to fill a bathtub with, But I guess it made for cool imagery. What are some things, because I don't know anything about photography. I do know that when you did my photo shoot, I've never been so sore in my life because of the way that Nichole has this way to make you, number one, feel so confident. And I've never had anyone taking my photographs or taking a photograph of me coach me through that. It was life-changing and fascinating, and the pictures exuded this confidence because she showed me how to do that. So like when you're working with pregnant individuals, is there anything that do you use the word medium for photography, or how do you?
I mean, it is a medium.
Okay.
But for me, it's really, I consider myself an intuitive photographer. And I just like to get to know the person before you sit down and shoot. I just so happen to know you prior to the shoot, but I learned some new things about you, and I was able to dive in to what you do and what you specialize in. And whether it be a career, minded branding, or if it's personal, like maternity shoot, I just try to get the essence of the person just by listening to their voice, their tone, their energy. And it sounds a little woo-woo, but I don't realize I'm doing it. I just do it.
Yeah. Yeah.
And then once I get to know somebody before the shoot, when they walk through that front door of the studio, they feel like they already know me. And I feel like I know them.
Yeah. I love that. I did feel very comfortable too. And I think that that's difficult to do when you're having something done so personal, which is like having a photograph taken of yourself. So do you do babies like teeny tiny babies sometimes, like those photo shoots too?
Yes, I do. And not the typical ones that you see. They're really like the fabulous ones that they like
ball them up
and put all these things on them and little costumes, which it's adorable. But more kind of a fly on the wall type of imagery.
Natural, I guess. Yeah. I like that. Do you like shooting in black and white?
Love it.
I love black and white photos. That's like my favorite thing in the world.
Yeah.
You can see a photo in color and you're like, I like that photo. And then if I could change it on my phone or somewhere to black and white, it like takes me back there or whatever. I don't know. Why is that?
I don't know. If I could shoot just black and white, I would.
Yeah.
But color is so beautiful. So I like to have that option. But I feel like my specialty is really like classic black and white, sharp, contrasty. It's just timeless. Classic.
Yeah, I agree with that. I love your stuff.
Thank you.
Okay, so now that we know all of what you do and then some, which I'm so excited to talk about, regarding families, pregnancy, stuff like that, you have one kiddo, correct?
Yes, one daughter. She's 15 now.
Oh, I love it.
And gosh, remembering back when I was pregnant, it was the first trimester was a little rough for me. The rest of the pregnancy was amazing.
Yeah.
I never thought I would love it, and I did.
You loved being pregnant?
I loved being pregnant. I felt super healthy and curvy and really like powerful.
Yeah.
Energetically.
Somebody said this the other day that they loved being pregnant, kind of like you said, and they didn't have that many curveballs thrown at them, right? They felt like they just had a healthy pregnancy. They did stress though that they had a super positive attitude and that they felt like that really contributed to it. Like, I'm going to do this, right? Even if I have a bad day, I love being pregnant. I'm creating a life. Like, this is what I want to do. Did you feel like if you had a bad day, it's like, listen, I'm still pretty lucky and this is exciting. Like, did you kind of guide that ship as best you could mentally?
I did. And it wasn't as easy. I mean, it's easier to talk about it now.
No.
The first trimester, I was really sick.
Throwing up kind of stuff. Yeah.
And that was very hard. And there was a lot of tears shed and a lot of concern. And I was losing weight and because I couldn't keep anything down.
Yeah.
And I really just kind of dug within. I had my doctor that prescribed some medicine and I just set it on the counter and just said, it's here if you need it.
Yeah.
I'm not going to take it. And that put my mind at ease that like everything was moving okay. And, but gosh, I wish I had somebody like you to help during the time that I was pregnant.
Yeah.
I mean, I don't feel like we had those types of resources available. And I think it would have made the first trimester a lot easier and a lot less anxiety and overly concerned, you know?
Yeah.
I mean,
so if you're able to reach your OB, like when you were pregnant, they can answer questions. I do hear from people it's sometimes hard to reach your provider, that happens.
Absolutely.
So like, did you ever turn to the internet some? Or like, I mean, I don't know, because I feel like now that's what people do a lot, right? Like that's their first go-to, even before they call their provider, is turning to not an internet search of like hospitals and provider offices, but just people giving advice. I don't know.
To be honest, I didn't know that was available to me. And I don't think it was as common 15, almost 16 years ago. Well, 16 years ago, actually. Than how it is now.
Right.
But yeah, I mean, just in getting those typical books of what to expect when you're pregnant.
Yeah.
And, I mean, I really try to read up a lot before I even got pregnant and then during.
Sure. Which is awesome. Most people don't do that. I feel they get pregnant and then it's like, oh crap, now I got to do stuff. I love when I hear that people do research and look into it before getting pregnant. I just think that's huge for advocating for yourself and knowing your body and what's going to happen to it. It's big.
Yeah. I think having someone like yourself on board to guide you, because there's a lot of misinformation out there, especially today.
Yeah.
You get a lot of opinions as opposed to facts. And I would much rather lean on someone who's board certified and specializes in high risk, et cetera. And we just didn't have those resources available at the time.
And I think too, any question is never too small. And that's where I think oftentimes pregnant individuals get lost. It's like, well, I don't think that's really the question for my OB. And I don't think it's a question for my primary care doctor who's not seeing me while I'm pregnant. And then maybe it could be a question if you see a high risk doctor. But if you don't, there's oftentimes this gray area where you're not sure where to go. And then I think that's when we turn to resources we might not trust. And I do love that you brought up nausea and vomiting, because I'll put some resources below. Anytime we bring up a topic, I'm like, okay, this is a time for a resource. So I'll put that below. But the wonderful thing now is, particularly in the first trimester, we ask people to get vitamin B6 and Unisom over the counter and take it preventatively. And it's very interesting. There's also different brand name pills that people can take now, right? They squish them together and someone makes money off of squishing them together and making them more expensive and needing a prescription, et cetera. But the thing that people might know, oh yeah, that's okay to take over the counter, but they might not know that you typically need to take it multiple times, because the study done on it, you could take it once at night and you could get up to taking it 3 to 4 times a day. And almost all people in that study needed the medicine at least 3 times a day. So when people are taking it, they might not know they could take it more, right? So it's all those little things too. So I'll put that down below with some information on buying that over the counter, because man, if you have something that you know is safe to take, not going to cause birth defects, right?
Exactly.
That's huge. And I do hear now that a lot of people are getting prescription medicine to take, quote unquote, I'm air quoting here, as needed. And that medicine has been linked with heart defects, little holes in the heart, and clefting of the fetal face. Now, those studies, you'd need to be taking a large amount of the medicine. So if someone's listening and they're like, that's not true. I mean, it's true, but it's true at high levels, because so many studies are done at monstrous levels of the medication. But for people who are like, I'm too scared to take something because it has a possibility of harming the fetus, the vitamin B6 and Unisom has been studied many, many years ago and for many, many years in total, and doesn't have that concern, right? So it's like education and knowledge being power,
Absolutely.
Which I love. Okay, speaking of that too, we have all these questions that I want to get into. Nichole has no idea what these questions are going to be, correct?
Yes.
Okay. She has no fear in her voice right now. All right. So 10 questions. These are kind of just some general pregnancy questions. So your pregnancy was 15, 16 years ago. So you may have forgotten some of these things, even if you knew them. So there's no pressure in getting these. There is a right or wrong, I guess, but there's no right or wrong. You're not getting graded. Okay.
This is good. This is good.
This is great. It's the best kind of test ever or quiz ever, right? No grades. Everyone wins. All right. Question number 1. What does the abbreviation OBGYN mean?
Obstetrics and gynecology.
Yes. So good. Okay. Question number 2. What do the letters MFM mean? What do those stand for?
Maternal-Fetal Medicine.
Yes.
I cheated though, because I did your branding.
That's true.
Yes.
So she does know that. That's just not cheating
about it.
You just remembered it, which is like, good. I mean, people that I know, friends and family, sometimes still don't know what I do. And they've heard it for ad nauseum for years, right? And we also call it perinatology, which is a bit of a mouthful too. But I like maternal-fetal medicine. I think it's very clear as to what I'm treating then, right? Maternal-fetal in medicine, right? All right, question number 3. How does a provider come up with your due date when you're pregnant?
They try to base it on the day of conception, which is a guesstimation based on when you had your last period.
Last menstrual period, correct. Yeah. First day of last menstrual period, then they do an ultrasound and then they kind of see if it jives. I have an entire YouTube dedicated to this. What is my due date? describing it because it's confusing. Do you remember when you were pregnant, were they like, here's your due date and it stayed that way, or did it change a time or two? Do you recall?
It changed a little bit.
Yeah.
But I did see that video and it really kind of put together some of the questions that I still have, after the process. But it makes sense. I mean, it's a guesstimation. I'm very in tune and aware of my body. So I think I had a better idea before they did.
Yeah.
My mom even knew before I did. So
people sometimes just know, you know? You just know. All right. Question number 4. When is a pregnancy considered term?
36, 40.
Close. 37 weeks.
37.
Yeah. Your due date, and this always makes it even more confusing. When we say your due date is April 2nd or whatever, it means you're 40 weeks exactly on April 2nd on your due date. And then you're considered term, early term technically, but the first time that you roll into the vocabulary of being term is 37 weeks.
Just to make it confusing.
Just to make it, to make it confusing. Oh, you gotta love it. You gotta love it. Medicine complexities. All right. Question number 5. You're far out from this, so I'm curious about this one. Question number 5. What is a normal fetal heart rate?
The number, I don't know, but I know it's high.
Yes.
Like over 100, like 130, 140.
Yes. Perfect. Between 110 and 160. Okay. Perfect. You remember all this stuff. This is great. Question number 6. What is antenatal testing? Sometimes we call it fetal well-being testing. Do you know what that is? So it would be kind of like typically in the third trimester, if you need fetal monitoring because you could have a higher risk of stillbirth. Either they put those 2 belts around you or they do a quick ultrasound to check on how the baby's moving around and practice breathing. Not everybody has it in a pregnancy. Do you remember in your pregnancy near the end, did you have to go in once a week for like quote unquote testing of the baby or anything? You might not have had to do that.
I just remember, going in and checking the heart rate and the dimensions and
the measurements and stuff. Yeah. Okay. I love it. Yeah. Some people, when they do fetal monitoring like this or antenatal testing, depending upon what the medical condition might be or the risk in the pregnancy, some people have to go in once or twice a week for the last month or so of their pregnancy. And I talked to a couple of people and it's like, that's a lot of appointments, and if you're working, how do you get off work 2 days a week to go? Because the appointment itself might take only 30 minutes, but you've got to leave work, drive there, park, go in, sit and wait, be seen, right? Like it has to take probably 3 hours total, I would anticipate.
Yeah.
And what if you don't live close to your doctor's office?
Yeah.
Oh my gosh. It's a lot, right? It's a lot. All right. Question number 7. How does an ultrasound estimate the weight of a fetus?
They base it off of the circumference of the head.
Yes.
And then the side.
Yes.
And then you mentioned the arm, but if the arm's bent, then they can't get the accurate. So they do it from the shoulder to the elbow. Upper arm,
and
then the femur to the knee.
Yeah. The like femur itself. Yeah. Yes. And then around the abdomen too. Did have you been watching some YouTube? Oh my gosh, she's learned so much. Would you say that had you not watched that, would you have known that that's how they do the weight of the baby? I think you knew it's measurements or something, right?
Yeah, but I literally thought it was from head to toe.
See?
I had no idea it had to do with.
There you go.
But that makes sense because you explained that it's, the baby moves around. They're all cozy and cuddled up.
Yeah.
They can't bend those specific areas. So that makes sense.
Yeah.
They would use that as a marker.
Yeah. They get, when they're early on, like around the 20-week mark, they're stretched out, right? Because they're smaller. And it's funny because I think parents are always like, oh my gosh, they're so big because we put it up on the screen and they look so much bigger. And then when they get further along, they're like, are they running out of space because they're squished in there? But you have to think when they're around 20 weeks, they may have weighed like 10 to 12 ounces, right? Like a 10 to 12 ounces.
Yeah.
Then when you're in the third trimester, you're getting kiddos that are hitting the 5-pound mark, right? That's a big difference in size. So of course they're going to be squished in there. They They can't, stretch out and, do all that. We call it fetal crowding. That's the way we say it. That's the medical term. When they're scrunched in there, we say fetal crowding.
Fetal crowding.
Fetal crowding. We have to have a weird term to describe everything to make it sound more professional, I think. Right? Of course, of course. All right. Question number 8. What makes up amniotic fluid?
It is the fluid in the sac, but I don't know. I don't remember.
Baby pee.
Oh.
Yeah. It's legit. Like, that's how we know their kidneys are working once they're so far along, is they're peeing out, they're making urine in their own body, right? Because their kidneys are working. Then it goes down into the bladder. And then from there, they pee it out into their little sac, their gestational sac.
And is that, aside from the baby getting bigger, add fluid, is that when, that's what happens when the water breaks?
When the water breaks?
It's
it's baby pee that's coming out. Yeah, yeah. And they swallow it too. So they pee it out, and then in the womb, they swallow it. And so when they have a stomach, so this is why I love talking about ultrasound, because the stuff that we're looking for in an ultrasound, most people think it's like the gender. I think people are so focused on that.
Sure.
And we try to see it if a fetus will let us, but we're looking at all the structures from head to toe. And some of the really important structures we're looking at, if we see a fetal stomach and a fetal bladder, and then the amniotic fluid around the baby is normal, I know that fetus is swallowing because they've taken the fluid down to the stomach. I know that the kidneys are working because they're able to get that fluid all the way down to the bladder. And then if the fluid around the baby is normal, then I know that they're actively at some point peeing. Isn't that cool?
That's crazy.
Yeah. So how, what was it on Sex and the City where her water broke on a really nice pair of shoes, right? Not many people, that always happens on TV, I feel, right? It's a dramatic gush of fluid. Most people, when their water breaks, it's not a gush, it's a trickle. So it can be very challenging. And only 10% of people really have the water break like that before labor. It's more of the uncommon, not the common thing to happen.
Sure.
And so if that happens to someone, they'll still leak fluid for a while after because the baby's still, peeing inside there. Right. So when people are like, I don't understand if all the fluid left, how is there more fluid? Because the baby, hopefully, right, is continuing to generate more fluid because the kidneys are still working.
Right.
Fascinating. I think amniotic fluid is fascinating. All right. Question number 9. Who should be offered Down syndrome screening in a pregnancy?
Anyone over 30?
It's everyone. And in the past, at least when I was practicing, so not in the 50-year plus past, but in the more recent past, we talked about it more with women 35 and above because they have less eggs in their body, and the rate for people at that time, the rate of having Down syndrome could be higher, right? But we talk about this too. If you look at individuals all ages, you see Down syndrome more in the younger population as an overall number, but it's more concerning. Your risk of having a child with Down syndrome is higher if you're 35 years old or above when you are pregnant. However, we offer it to everyone now because the risk is there for everyone, right?
Right.
And then they had these tests where one was pretty good, the other one was really good, and they would offer the pretty good one to lower risk people, so younger individuals, and the really good one to higher risk, 35 and above. And now they offer it to everyone, the better test, I guess you could say.
Sure.
Yeah. And I think part of that too came along with the branding for the test and who had it and how much it was, and when it became with the ability for other companies to run the test, kind of like pharmaceutical company, right? When something goes from a brand to a generic, it just opens up a whole new world, right?
Yeah.
Fascinating.
Mm-hmm.
I don't like to dabble in that world of insurance and pharmacology. It's just, there's a lot of stuff going on there.
Absolutely.
All right, question number 10. What is considered a normal length of a cervix in pregnancy?
I have no idea.
That's okay. And that's a terrible question because for some people, when I talk to an ultrasonographer, and it's oh, that's a loaded question because it's different depending upon how far along someone is in a pregnancy, Right. So, all right, those were our 10 questions and you did great. And now we have 10 quick true or false questions.
Okay.
Question number 1, true or false? A fetus can have hair in the womb.
Yes, true.
Question number 2, true or false? A fetus can hear.
True.
Question number 3, if a pregnant individual eats sugar, this will wake a fetus up if they're sleepy.
I mean, I don't see why it wouldn't.
We go back and forth on this one because from the data I've read, it appears to be false because babies go through sleep cycles. And so when they're sleeping, if the pregnant individual ingests any type of food or drink, yes, is it going to ultimately, process? Sure. But is it going to get to the baby and change the baby's sleep cycle and wake them up? No.
Okay.
Yeah. Some things we can do to wake a baby up, quote unquote, is fetal acoustic stimulation where there's like that vibration.
Mm-hmm.
And that goes back to kind of like, can a baby hear? Yeah, after 25 weeks, they can sense acoustic stimulation. And so that's how we kind of say, oh, they're hearing, right? Because they are sensing this acoustic stimulation. So that's kind of fun. After 25 weeks, they get that little excitement when they feel a buzz on the mom's belly.
That's
All right.
cool.
Yeah, and then neat. Question number 4, true or false? Everyone should be screened for diabetes when pregnant.
Yes.
True. Perfect. Question number 5, true or false? Everyone should be screened for thyroid disorder when pregnant.
I would say that's true.
This one's false.
Okay.
A lot of people are being screened because it's so easy to just throw another test in with all the labs that are being sent. And it's just opening up cans of worms as life goes on for pregnant individuals because the thyroid changes in pregnancy. So there are going to be some thyroid levels that look different but could actually be normal because they're pregnant.
Right.
So as of now, no. And I think honestly part of it is because people ordering the test in pregnancy, when they get the results back, the results are for non-pregnant people. If they don't know how to interpret the results for a pregnant population, then they, as the provider, might think they're abnormal.
Right. I see what you're saying.
So
Yeah.
that's the main. That could change later if they start getting correct values for pregnant individuals on the report. What you'd think, though, here's my soapbox. If you're an ordering provider of a lab and you're ordering for pregnant individuals, wouldn't you think that you would know what the normal value is for a pregnant person?
Yeah, absolutely.
Yeah.
Like pre-pregnancy and then during pregnancy and then post.
Yeah. You would think, but maybe you wouldn't be shocked at how many patients I've seen that get referred in from an OB provider of sorts for abnormal thyroid. And I get the pleasure of saying, hi there, your thyroid labs are normal for a pregnant individual. Have a great day.
Right.
Like those are my favorite consults because I get to tell someone good news, and share with them nothing about this is high risk. You're good to go. Have a great day. Right?
Yeah.
Like how great is that? I know. I love days like that where I get to give good news to people. All right. Question number 6. Someone with 2 prior cesareans has to have a third.
I would say true.
False now. It used to be true.
Okay.
So we just recently changed it from 1 prior C-section. You can still try to have a vaginal birth. Now it's 2 prior C-sections. You can still try if you're the right candidate. So not everybody can, right? So it's a little different. Did you have a C-section? Do you remember?
No, I didn't.
Do you remember? Like you wouldn't remember? Oh my gosh. Did you feel like delivery was pretty seamless? Was it stressful? Was it, you remember like that part?
I was terrified, I'm not going to lie, of being pregnant, having my first child, vaginal birth. Like, oh boy. I mean, everybody's fearful of that, right?
Yeah.
Aside from the first trimester when I was sick, it was so easy. I worked up until the day I was in labor.
What?
I thought I ate like a sandwich or something that made my tummy uncomfortable. And I went to go lie down. And then my husband at the time had called the doctor and said, just want to let you know, she's got a little kind of like upset stomach. She's like, oh, she's having contractions.
You're like, oh, that's what those are.
Yeah.
Yeah.
And she said, if the time in between gets shorter, X amount of, I don't know what the intervals were at the time. I don't remember. Then just don't call back. Come on in.
Yeah.
So I take my little nap and I'm like, oh, wow, this could be it.
Yeah.
You know, I had no idea. And the contractions started to get closer. And so my husband called the doctor and she's like, what are you doing? Get off the phone. Come here. I told you not to.
Start driving. So when you made it there, how long? Because some people say, we barely made it to the hospital. Were you in that situation where it's like, oh, baby was coming in the car almost?
No.
Okay. That always makes me nervous. I'm sure it makes moms nervous too, right?
Right.
Yeah.
But it was, we got there. I walked around the ward and I walked around for an hour or two. It went by fast, actually.
Yeah.
And then I was in labor and
did you get an epidural? Do you remember that
got
part?
an epidural.
Yeah. Was it like, oh, this is great?
It just, I don't know. I handled it surprisingly well the entire time.
Did you just like zone out in a way? Like you were just like, I'm going to do this? Because I've read in books too, when people are like practicing and they're like in the zone at something, they almost can't just not describe it, but they just feel like they were in this place of such concentration and whatever that you're just like in the zone. Did you just feel like you were in the zone kind of?
Oh yeah.
Yeah.
Which is like the antithesis of how I felt when I was younger. Like I was always very anxious and highly sensitive. And I was just amazed at how well the whole process was.
Nice.
Yeah.
That's awesome.
Yeah.
And when you delivered, did you have a bunch of people in the room? That's something I've had a lot of guests talk to me about, that it was like, not a zoo, but there was a mom, a dad, a mother-in-law, a sister. Did you feel like there were too many people in there, or was it kind of nice and private?
It was private.
Yeah.
Yeah. The nurse, the OB, my husband, myself.
Yeah.
Yeah.
That's awesome. You could focus.
And I had a playlist, a specific playlist.
Oh, I like that. Do you remember what song was playing when you had your baby?
No, I do not.
No? That would have been funny if you did. And then like every time that she has a birthday, it's like, this is your song.
Right. She's like, what?
And if your playlist had something so, random and you're like, Mom, why is that my song? Right?
Yeah.
That would be so funny.
It does pop on my playlist now, like in the car. And I told her a couple weeks ago, I said, I had this song on when, we were in the delivery room. She's like, oh, Mom.
With us, it's like, oh my gosh, that's so cool. Right. And with her, she's like, I don't want to know these things.
Yeah. She's like, ew.
I love that. Oh my gosh. And then postpartum, I do hear from some people too that postpartum, we're now calling it a bit of like the fourth trimester. From a provider standpoint, I do feel like this is when individuals get forgotten sometimes, right? Like they don't know when their next OB appointment is. It's almost like once the baby's delivered, it's like you're on your own. Did you think that postpartum for you, as far as with your provider and how like the care you got, do you feel like you were kind of like, yeah, they had me, they checked in on me and stuff like that? Or did you feel like it was like, yep, here you go home with the baby and best of luck to you?
The latter.
The latter. Oh, shit. Sorry. Shit. Snapdragon.
Snapdragon.
I don't know the right thing to say to that. I want to say shit.
It was difficult at best. That's when my intuition kicked in and just fed off of her energy and what I thought she needed. What do you do? I mean, you have this like little alien in your possession now, and it's a lot.
Yeah.
And if I only had someone that specialized in maternal-fetal medicine and understood that fourth trimester, your hormones are all over the place too.
For sure.
So you're like, why am I thinking these weird, crazy thoughts? Am I normal? What's happening here?
Right.
And if you just had someone to say, this is all normal, do X, Y, and Z, take X, Y, and Z supplements, eat this kind of, diet, for lack of a better word. All those things help kind of level things out. And I did what I thought I could do, but I was so exhausted that
Yeah.
I couldn't think straight.
Yeah.
So it was a good experience, and I bonded, but it was tough.
I think that has to be one of the hardest times, especially if it's the first go round, you know, like you don't know what to expect. And then I feel like maybe people saying you should do this, or like, you know, you're getting this unsolicited advice from individuals. The breastfeeding topic always stresses me out because I feel like there's a push for postpartum individuals to always breastfeed. And if you're around people that may have had a child, they're going to give you their 2 cents worth about, are you breastfeeding? Why are you not? You should try this. I have friends that have struggled with that. And I find it very judgy for others to come up and tell you what to do with your body. Yeah. And I'm like, no. Did you ever feel like you got pushed from just random people even, or did that happen to you? I feel like that happens.
Yeah, for sure. I mean, I think just our society, our culture, I think it's a great thing. I think, you know, we provide the colostrum, which helps with their immunity. I'm sure they've found more studies that it's, you know,
it's good. Yeah, it's good.
But if it doesn't work and it's like the baby's fighting it, and my daughter ended up having like not colic, but lactose intolerance. Mm-hmm. So I actually had to, with my naturopathic doctor, they were MD, but they also specialized in homeopathy. I had to make her own formula up.
Oh my gosh.
Yeah. And
because her intestines kind of just weren't handling certain things.
Right.
Kind of. Okay.
So that was stressful. I feel like there should just not be any judgment across the board, because an individual energetically knows what's right for them and their child. And I think once you don't really know until you go through it. Mm-hmm. And my goal was to do a completely natural childbirth, to breastfeed and, you know, do all the things. But once it happened and we tried, I'm like, you know what, my daughter's going to stress out because I'm stressing out, and I'm not going to produce the milk. And, you know, so I tried, but it shouldn't be a judgment. Whether someone chooses to do that or not, as long as they're a good parent and they're doing their best to make the best choices that they can. And I think that's where you come in too, because it's having that extra guidance and just that encouragement. Like, look, this is your body, this is your child. I'm going to make these suggestions, and you know, do what you can.
Yeah. Patient autonomy. I mean, empower someone with the information and allow them to make the choice that feels right for them in their situation. So when you kind of, I love how you did this too, how you told me the things that you wanted to do. And then when those things weren't working out, you allowed yourself to shift. You didn't beat yourself up over it, you know? And I remember in training when we had patients that would come in with a birth plan, it was kind of like, it was an inside feeling as a provider. It was like, oh my gosh, this is going to end up being a C-section because they're not wanting a C-section. This is going to end up being this and that, because the expectations and the lack of flexibility in case things went sideways. And so that's how, you know, when you're working as a resident and you're tired, you're like, oh, it's a birth plan, so it's going to end up being everything the opposite of what this person desires, right? And no one wants that for the individual.
Sure.
But some people that come in with, these are the things I want, don't allow that flexibility of, the baby might not want these things, meaning like the heart rate could go down, or maybe the baby is breech and or maybe the baby's not fitting through the pelvis, you know. So I always tell individuals with a birth plan or that have things they want, yeah, these things look like we can honor these things. We're definitely going to honor these things as best we can. Some of these things might have to change depending on how labor goes or how postpartum goes, right? I see that you want to breastfeed. Be aware that if you can't breastfeed, we can try to help you and we can get you a lactation consultant and this and that. But if you can't or something happens, it's okay. you know, like allowing yourself to just shift, like due dates. You know, we talk about people are like, I want to have my baby on this day. It's your baby show, you know?
Right.
Like I'm going to do my best to just get you a healthy baby at the time that the baby might want to be coming out, right? And just kind of like, I tell people I translate a little bit, like your baby speaks this language, I speak this fetal baby language, and then I'll let you know what they're saying, you know?
Right.
So I love that. And you're a very intuitive person. I think I kind of am too, which is where we super jive, you know? And I love that. I love people who are intuitive because they just have this like ease about them. And I find I'm comfortable around people that have this high intuitive nature. Is that a right way to say that? Kind of? Yeah. I like it. I love it. Okay. This one's kind of fun. True or false? Twins that are the same gender are always considered identical.
False.
Correct. No one's gotten that wrong yet. I'm very proud of everybody. Like I feel like they're like on top of this. Question number 8, true or false? No cheese is safe to eat while pregnant.
False.
That is correct. Do you know which cheeses are okay to eat?
Hard cheeses.
Generally, yeah, because you want pasteurized cheeses, and most of the harder cheeses are pasteurized. Not all of them, but yeah, pasteurized is the key to go. But yeah, the soft ones oftentimes are unpasteurized. They might taste better if you like cheeses, right? You know? Question number 9, true or false? Someone trying to get pregnant should start taking folic acid before pregnancy.
True.
Very true. Good job. Question number 10. True or false? Baby aspirin is an over-the-counter medication that can prevent a certain type of high blood pressure during pregnancy.
True.
Yes.
Because it helps in the blood, but it's so minimal.
And you know, it's when I talk to some people think, oh, it's going to lower my blood pressure and that's why it will prevent preeclampsia or decrease my risk of preeclampsia. It's actually mainly the anti-inflammatory properties that it has at the level of small vessels. It does thin the blood like just a hair, you know? So I always tell people that it's not going to cause you to have tons of bruises. Now, if you're super clumsy, like myself, if I could show you my arm right now, I leaned under this table the other day and stood up, and now I have a bruise like the size of a silver dollar because I'm clumsy. I do take aspirin every day too, but I don't, you know, if I tried to rollerblade or do something outdoorsy, I would be covered in bruises with or without aspirin. But I think aspirin, like if you're a sensitive, delicate flower like myself, you might just like have a little bit more, like you might bruise for a day longer or something.
Sure.
Right. So that could be a side effect for sure. Okay. So is there anything that you would say if you have the ear of someone right now who's going through or about to have a first pregnancy and they're working and they're on their feet all day and they're busy, maybe they own their own business too. Like they're just like, they've got all the things going on. Is there any advice you would give? Because part of what I want to do with this is having an effect on someone. I always say like it's the impact that I want to have, right? On helping people with their education and something that we can do to positively impact someone else. Is there anything you would want to tell people or any advice you'd want to give or anything like that?
I would just say listen to your body. If you feel tired and you need to take a nap, take a nap. I would try to take naps, but especially like during pregnancy, and I'd have to force myself. But just taking a time out and just relax, listen to your body.
Love it. I like that. Now I want to take a nap. My body says I need coffee.
That's a surprise.
I know. And speaking of, we talked a little bit about cheese and coffee. Their YouTubes, they might be up already. Depends on the date you're watching this or listening to this. But with regard to caffeine in pregnancy, which is I think a super interesting topic. And then one about cheese in pregnancy too, which is kind of fun to learn about why we care if the cheese is pasteurized or unpasteurized. So today we have tried our best to expand knowledge. We have looked at information surrounding photography. This is my favorite topic, I think, because we've been able to talk about what you can do. Actually, if you want to check out any time, Nichole, can you tell me really quickly before I forget to put this down too, as far as I know, you're Nichole Smith, but the name of your company is different, which is why, and we know each other. For the longest time, I was like, wait, is your last name like a first name? But the name of your company, just so that people kind of have that in the front of their brain.
Yes, it's my first name and middle name. So Nichole Catherine. My last name is Smith. And I kept that since that was my married name for my daughter. So she and I would have the same name as she was growing up. So it's Nichole Catherine Studios. And it's NicholeCatherineStudios.com is my website. And that is currently being revamped. So if you want to take a look at some of my imagery, you can go to Instagram /Nichole Catherine. And that's Nichole. And then Catherine is spelled Kathryn.
Thank you for clarifying that, because there's various ways to spell both of those names.
I know.
And then I was going to say the grid that you have on Instagram is so beautiful too.
Thank you.
Like all the photographs, I'm just like in awe of them all the time. And the photographs of yourself, by the way, are fantastic.
Thank you.
Absolutely fantastic. So as always, expanding our knowledge surrounding topics with pregnancy, developing skills on asking your provider questions. And don't forget, listen to your body. If something's going on, doesn't feel right, tune into that. And having an impact, doing our best to have an impact on you and your pregnancy. So thank you for tuning in. Don't forget to subscribe to the YouTube channel and check out social media. Everything's at drlexihill.com. Also get your free download for advocacy questions to ask your OB provider, drlexihill.com/advocate. Thank you again so much for joining us. I'm Dr. Lexi, wishing you a happy and healthy pregnancy.